So how do we use MRD to change management? So sometimes MRD is used to intensify or change therapy, and I'll give an example of that in a second. So if somebody is MRD positive after a cycle of chemotherapy or 2 cycles of chemotherapy, it might be a reason that your oncologist will change the treatment that you're getting or sometimes even intensify it. On the contrary, sometimes it's a reason to de-intensify therapy. So if you achieve rapid MRD negativity, again, depending on you, depending on the disease, depending on the time point in the disease, it might be an indication that you might not need as intensive therapy than you were planned to receive. And then very frequently in hematologic cancers, we talk about stem cell transplant, not in all cancers and for all patients, but in a lot of different blood cancers, a stem cell transplant is the best chance for a cure. And in some patients who achieve a rapid MRD negative state, a stem cell transplant might not be something that's necessary. However, if a patient does not achieve an MRD negative state, the stem cell transplant might be brought back to the table. And so one very pertinent example to the work I do is in B-cell ALL, which is the most common type of ALL or acute lymphoblastic leukemia. And this is from the NCCN guidelines where we see that if a patient has B-cell ALL, we do response assessments. If they're in a remission, CR means complete remission, there's then a branching point as to what to do if they're still MRD positive or MRD negative. And here we have an approved drug called blinatumomab, which is a type of immunotherapy where patients who are persistently MRD positive or patients who achieve an MRD negative state and then become MRD positive, those patients are recommended to receive this drug, blinatumomab, that has an approval for MRD positive disease. For patients who are in a remission, we don't see any disease when we look at their bone marrow under the microscope, but we still see disease using the more sensitive testing. And so this is just one of many examples as to how MRD might be used to change management, but there are specific drug approvals for MRD positive disease and specific time points and branching points where we start to consider whether we should change our management of a patient because of the MRD status.